Hi, I'm Tiffany Slowinski, owner of Bridgewater Lifestyle magazine. Today I'm at Natural Medicine and Rehabilitation with Dr. Vince Sferra.
Very good.
Thank you for having us here. It's a pretty cool room. I don't know how much you can see in the background right now, but there's a lot going on in this room. I know you have no patients right now, which is kind of perfect, which is why we're in here. But thank you for having us in here.
You're welcome. Thanks for being
And
here.
I'm just super curious if you could share with our audience how you got into chiropractics and wound up opening up this practice.
Well, chiropractic is something I got into 40 years ago when I was back in college. I had a great chiropractor in the Somerville area who helped me out, and he turned me on to becoming a chiropractor. And I had an individual practice for several years through the later in the 80s, early 90s, and then I became ill, which was kind of a blessing in disguise. And it created an autoimmune problem in me, and it had me look into other avenues of healing. Through the early mid-90s, and I worked for a specialized lab as a technical consultant through that time, and I decided to get back into practice once I was doing better, but with a different slant on it to kind of be more comprehensive and not just be a chiropractor, which is great, but to bring in other areas of medicine, metabolic testing, looking at nutrition as a necessary approach to someone's health and reestablishing balance to their health, and the rehabilitation. So I did a lot of postgraduate work in those two areas of nutrition and rehabilitation, and in 1998 I decided to open up natural medicine and rehabilitation. So it's 23 years now.
Wow.
When we first started, it was myself, one person at the front doing billing and scheduling and all those things, along with another doctor, a medical doctor who started the practice with me. And over the years it grew. We have over 20 employees now, several physicians and doctors and clinicians, and it's just a great place. We do so many different things here that I'd love to tell you about.
Well, I know your wife works with you, so
Yes,
what
she
is
does.
her area
Yes,
of
she does.
expertise?
Well, she's a DPT, which is Doctor of Physical Therapy, and she's in a program right now to get her nurse practitioner degree. She's very, very passionate about women's health and working with women in all different areas of their health, whether it's musculoskeletal problems, but metabolic issues, female hormone issues. She's interested in nutrition in such a grand way, in a passionate way, detoxifying patients in regards to things that they do in their lifestyle that may be contributing to their problems. She's investigated that thoroughly over the years and helps them out a whole bunch with that. And she's, again, looking to get a new degree in regard to help them even further.
Because she doesn't have enough degrees, right?
Yeah.
A little
She's
more
very
school.
driven, very driven. It's great.
So you offer a ton here. Can you tell our audience a bit about the different services you have?
Sure. It started out just being chiropractic and some physical therapy 23 years ago, and it has grown into a number of different things. On top of those things, we do acupuncture. We do something called biofeedback, where it helps people out in regards to chronic pain, helps people with anxiety, headaches. Migraine headaches is a popular thing that we utilize that for. It helps do something called an autonomic balance with the patient. People who basically are more high-strung and tense and anxious, it helps all those symptoms that revolve around that for them. So I'm very fond of and high regard for biofeedback therapy. You don't see it out there too much, but we do that here. We do a lot of specialized blood testing. We look at comprehensive blood work for metabolic panels, lipid panels, inflammatory markers, hormone balancing, a number of different things. And we also do specialized laboratory work for different autoimmune type problems, trying to dig a little deeper into why people may have problems with autoimmunity. We have some occupational medicine that goes on here. So a lot of stuff going on.
There's a little something for everybody.
There is, there is.
Can you tell us a bit about your approach to long-term health and wellness?
So that was born while I was in the interim of not practicing, when I had ill and was working with the medical lab. I just said, you know what? So many people had come to my practice before with back pain, but they also were overweight, not eating well, okay, stressed out, not exercising, being sedentary. So when I started this practice, I said, we're going to have a tenet, and it's going to be the triad of health, where you are what you eat, think, and do. And that is really what motivates me, and I think all of us now in our vision, to not just have somebody come in to do rehab to make sure they're elbows working better, or their knees doing better, or their back. But if they have these issues, say their diet is poor, they're a little overweight, or they're inflammatory because of their diet and their lifestyle, they're sedentary, let's get with them. And while they're here for the 6 weeks or 2 months, whatever it may be, doing their rehab, can we influence them in a positive way on these lifestyle habits that can really have an impact on their life for the rest of their life? Okay, and many people grasp hold of that. You know, they love the concept. They realize it's the right thing. Some, you know, dig in a little deeper than others, but they're always appreciative of the teaching that we look to do to help them in those areas. So I think that's the big thing, looking at all those lifestyle parameters in a setting like this, that maybe they were just coming here thinking they had some back pain.
So they start with the back pain, and then once they're here, they realize there's some other things I could be doing.
It's like a positive bait and switch, but it's all educational. It's all education. They don't know what they're getting in for. So we have all this stuff out here, and I even put windows there to make sure people would see, hey, what's going on here? You know, what am I getting myself into? And you know, we want them to know, hey, we want a shift for you guys. We want you to become, you know, an advocate for your own health. We want you to become strong. We want you to learn about nutrition for you and your family. Okay, it's that important. We cannot rely. It's archaic to have a mindset out there that your health is just something your doctor takes care of once a year on a physical. You have to get involved. You have to get involved. You have to know what you're putting in your body, what you shouldn't be putting in, what you need to be doing with your body, and you have to be intelligent enough with health and healthcare to ask some good questions with your doctor.
So you guys do a ton of seminars here. And I came one time and I got this little sticker. It was almost like a mood ring, and it was like, "How stressed are you?" And mine goes like straight to black, and I'm like, "Whoa!"
As long as it didn't melt.
I'm like, I guess I am high strung. So you look like you are fairly fit. Definitely, I think living the life that you talk about. Can you give our audience a few tips for healthier living?
I certainly can. How much time we have? So listen, I think that when you go to a doctor that's going to do this, maybe not a specialist that's just there to cut out a cyst or, you know, do a surgery, but somebody who's going to talk to you about your health, they best be a living example. And you don't have to do everything they do, but you certainly want to be with a physician who looks a little bit like they know what they're talking about. And you can be fooled by that too. Looks aren't everything, but it is true that you know, I look to lead by example, and it revolves around those same tenets of health, that triad of health that I talked about earlier. You are what you eat, think, and do. What do you put into your body? What do you put into your mind, and how are you thinking? Are you spending time just looking? You know, the internet and these devices are a double-edged sword. We can just waste a ton of time, or we can get really, really educated. Okay, what are you doing? What are the choices you make? Do you want to just get entertained, or you want to educate? And when it comes to health, there's so much out there that we can. There's some information that may not be the best, but there's a lot of good stuff out there too. So
educate. Are there any good resources you could recommend for that?
Well, I would say that for the lay person, I'd have to investigate it. Okay, there's different institutions and websites that I go to for my own self and for my own edification, but I would say it's probably something I would have to educate myself on to let people know about. Off the top of my head, none come to mind. But you know, you can certainly look into just PubMed is a National Institutes of Health library, and in there's a host of things that are free to look at. It may be a little daunting for, you know, the lay person, but you can start to get involved a little bit in that regard. Institutes of Functional Medicine, IFM is a great resource that we use as functional medicine practitioners that has some resources for people as well. Okay, so that's something. Our website, you may be able to find enough to get your appetite whet to learn more and investigate, and certainly we try to do a host of things for our patient population and the lay people around that choose to. We've since the pandemic, we've certainly done most of it online with Zoom lectures and things like that. But as you know, we've done a ton of them here, and the practices have been built, both my first one and natural medicine, on going out and doing presentations, you know, in the community and the corporate sector, as well as in the community, on various aspects of health. I think at this point in time we have about 30 plus different lectures that we've developed. But getting back to the original question, yeah, it's educate yourself, really get involved in nutrition. Don't just dabble, I think it's good to eat, better, so you just, you stop eating whatever, but you're still eating a lot of processed food and still sugar. You got to get involved and put the things in your body that the body really needs to repair, regenerate, and thrive. And then, the other biggie is the exercise. The exercise is so critical that we move. None of us are really in the type of job where our work is our exercise. Some maybe, very few. And again, with the pandemic, there's been even more sedentary nature for people. And we have to fight that. We have to fight that. It's not a good thing for our health. It's not a good thing for our children. So, and I think as we get into a little bit of shape, we want to get a little more rigorous with ourselves than most people do. And work out like you're a little bit of an athlete. Consider yourself such. You may not be going to the Olympics, but you're certainly fighting for your health and the sake of your families as well. And if we can give our kids those examples of, being fit, of putting the right things in our body, putting the right thoughts into our brain, it gives them a fighting chance, as they get a little older and on their own.
What do you like to do for exercise?
I box and I weightlift. Okay, I've been a weightlifter for 47 years now. And I competed at a high level back in my 20s, and now I just do it like I'm going to compete, but I don't, because it's in my blood, and I do believe that most of us can work a little harder than we do with this. We don't need a lot of time. Okay, as a matter of fact, if you work a little harder, you can spend less time. That's one of there's very few secrets. You really just got to get in and do it. But one of the secrets is put some good strong effort in, and you can cut back on the amount of time that you'd have to spend doing this. And everybody, what's the main excuse? Don't have the time, right? Well, if we can get ourselves in condition to work a little harder, then we probably don't have to spend as much time doing this.
So everybody likes to have a little fun sometimes. On your rare occasion, you get a cheat meal going. What's your favorite food?
Spaghetti and meatballs.
Ah, okay.
From Raritan, and I'm a hometown Italian boy, so spaghetti and meatballs for sure. Maybe a little Italian dessert after that. A sfiadelle, as they say in the Italian bakery. So that's my thing.
You're going for a carb load when you get that good meal.
Why not?
So how can somebody learn more about NMR?
Well, probably the website. I would say prior to COVID, we would have pretty regular meetings in here every couple months. We would invite people in. You've been here. We've had 70, 80, 90 people in here at times doing presentations. That's not happening right now. I certainly hope it does in the future. I love doing them. But go online. We're doing some new things with the website, with some blogging, and just trying to get a little more meat to it. But there's a lot on there to learn about various things. Yeah, and as well, I've always done this. I've always offered a complimentary consult. Now that is true complimentary. It's not complimentary that once you come in, we're looking at your insurance. It's you come in, you come out. We're not going to ask you about that stuff. So you can come in and learn about our stuff. Most people that do that have something they want to talk about regarding their own health, right? And I talk a little bit, ask some questions, gain some insight, enough to say, hey, maybe this would be helpful to you, or I should point you in this direction. Or maybe we're just going to say, try this exercise. There's usually some take home from that complimentary consult. And as well, there's usually some recommendations that may have them look into other services that we do at that time. And then we can look into how their insurance covers it and what the costs are and things like that.
I love that, because you offer so much that somebody might even feel overwhelmed, like, I don't even know which way to go.
You know what happens sometimes? Sometimes people come in and they have in their mind, I want to do this. And then as I'm talking to them and they're listening and we're answering questions, they realize, wow, I thought I wanted this, but my body's weak as heck. I need some other things, maybe even before the thing I thought I needed. So we have that discussion, and again, through education, I try to impress upon them what may be more important right now, and then maybe those things later, or vice versa, whatever it may be. So it is I believe it's a very valuable visit, and we'll spend 20, 30 minutes, so we spend a fair amount of time, trying to figure it out.
Is there anything else you'd like our audience to know?
This is a great place. This is a great place, and I think that the experience here by many would attest to that. My understanding, although I'm never on these things, is that our website and Google has an astounding amount of positive feedback with the reviews and the testimonials that are in there, and we're very blessed and grateful that we have people coming in and being willing to express themselves in regards to their experience here. So I think that's the coolest thing. It's a great place to work, and some patients, can't get them out of here. They love being here so much. It's fun.
Well, Dr. Sferra, thank you so much for having us here today. Tiffany
Thank you for being
Slowinski
here.
signing off from Bridgewater Lifestyle magazine, Lifestyle Live, and we're at Natural Medicine and Rehabilitation.